Thanks so much for joining us on this Sunday. Canadians are anxiously awaiting COVID-19 vaccines for kids and many to book booster shots too. It can't come soon enough in some parts of the country. Infections in some parts are rising yet again. Manitoba right now is the hot spot in Canada with the highest infection rate. The province is implementing new restrictions. There are now limits to religious gatherings in parts of Manitoba in what's called the Southern Health Region. Vaccine rates there are low. Hospitalizations are up, and starting on December 6th, most young people who play indoor sports will either need to be vaccinated or regularly tested. Earlier this morning, I spoke with Manitoba's Health Minister Audrey Gordon about the decision to implement these new restrictions. Minister Gordon, thank you for joining us this morning.
Thank you for the opportunity, Rosemary.
I want to start with these new restrictions. Do you think that they are going to have an impact on reducing or slowing the spread of COVID-19?
I certainly do believe that they will. They are meant to lower the numbers of individuals that are congregating in large numbers. And that is when we see the transmission of COVID, is when individuals are together for long periods of time. So yes, I definitely believe that these restrictions will help to lower the increases that we're seeing in our COVID numbers.
The models that we saw from Dr. Rusin, your Chief Public Health Officer, on last week, saw that Manitoba could have 200 cases a day by mid-December. Why not do something more drastic now? Because the restrictions are very targeted. Do they need to be broader in order to slow down the number of cases?
Well, we're definitely following the epidemiology. So data comes into my office and to public health on a daily basis. So we're monitoring the numbers very, very closely. And as I said previously, we do believe that the restrictions that we put in place on Friday, the 12th, will help to bend that curve. And if it doesn't, we've been very clear to Manitobans that the restrictions could be changed on a daily basis. Yeah. So I could be out next week making changes if we see the uptick continue.
One of the areas where you are having difficulty, and one of the areas that the new restrictions target, are religious gatherings in the southern part of the province, where the test positivity rate is extremely high, above 14%, and the vaccination rate is extremely low. What are you doing to try and convince people in that part of the province that getting vaccinated will help, matters, and that they should do it?
Well, we have several communication materials that we're putting out in that specific region. We're also working very closely with primary care physicians, pharmacists that tend to have close relationships with their clients. And so we are very much on the ground. So we have teams on the ground that are talking to individuals one-on-one and trying to address the issues around vaccine hesitancy and testing hesitancy. And we will continue to move forward with those efforts.
I was speaking with a pastor about this issue in that part of the province, who is concerned that this restrictions on religious gatherings is very difficult for communities. How are you also going to enforce that? Because it would seem difficult in a church or religious gathering to go in and make sure that people are complying.
Well, and that is exactly what our compliance and enforcement officers will be doing, Rosemary, because this is very important that we keep all Manitobans safe. And I was very heartened to see, just on Twitter and social media and in the newspaper, that some of the churches in that area have decided to go to online services. Some will be starting up their drive-in services where individuals can stay in their vehicle and tune into their FM station. So they're already taking steps to address the concerns that we have with the numbers that are gathering indoors for long periods of time. So I'm very pleased to see those steps being taken.
Manitoba has the highest rate of infection in Canada, as I'm sure you know, but so other people can know too. And the increase seems to be people under 20 years old. Do you have any sense of why that's happening and how you can target and shut that down?
And we also have a very high vaccine uptake. So we are seeing numbers, 84 84% of individuals have 2 doses and 87% have 1. And that's for the eligible population. So for individuals under 20, what we have done with these restrictions, because we find those individuals tend to play indoor sports like hockey and soccer and others, is we are requiring them by December 5th to at least have 1 dose of the vaccine. And they will have to show proof of having that 1 dose of vaccine to be able to play the sports that they enjoy. So we are trying to target that age range. And we hope to very soon hear from Health Canada that the Pfizer vaccine for 5 to 11-year-olds is approved. So that will certainly help as well.
You also announced on Friday that some upcoming surgeries will be cancelled to free up ICU beds. The leader of the NDP, the opposition leader there, Wab Kinew, says the reason that you're cancelling surgeries is because you haven't scaled up your intensive care capacity. Is that accurate? And what more should you be doing right now to expand capacity rather than just cancelling surgeries?
So there are several avenues that we're pursuing. So one of the things that we are doing is we will be announcing very soon a surgical backlog task force. They will be very heavily focused on what we need to do to ensure individuals get their surgery and their diagnostic tests. We also put out a request for supply arrangement so that we can receive proposals from many different service providers in terms of helping us to carry out those surgeries and diagnostics. And then, of course, I'm requiring that all health facilities look at individuals that can be transferred. So if an individual is in an acute care hospital, in a bed in one of our acute care hospitals, we're looking at whether that individual can be transferred to an alternate level of care facility. So still receiving the appropriate level of care, but outside of our acute care settings that are feeling the pressure right now with the increase in COVID numbers. So several measures are being taken.
Okay, Minister, I got to leave it there. Thank you so much, though. I appreciate you making the time for us this morning.
Thank you very much, Rosemary. Stay safe and be well.